Bila shaka tuko ndani ya 103.9 MMUST'S FM, tukiwa ndani ya Gumzo Kazini. Hii leo ni siku speciali, kwa maana kutoka siku ya Jumatatu, msikilizaji, nimekuwa nikikwambia kwamba leo kutakuwa na mahojiano ya moja kwa moja ndani ya redio ambayo unaipenda, MMUST'S FM, nikiwa naye mgeni mashuhuri, naibu chancellor wa chuo hiki cha Masinde Muliro, anajulikana kama Professor Solomon SHIBAIRO.
I was appointed when I was on leave.
Okay.
And I was told you are supposed to be in your station 2 days ago. So I wondered, what in these times of corona? But I said, given that I'm a leader, you always say yes and report before you ask any question. So I arrived. And I've already developed protocols, developed strategies in which we can do. This we did with first of all with the council, and then we developed the management and Senate together with many other stakeholders in the university. And one of the things that we have done, we have put measures to do some of those, to control and even manage and of course operate in this very environment. And I want to tell you, it wasn't easy. Yeah. The university has many strategies. One of them is that we have developed what we call an emergency response team.
Yes.
And that response team is working under the leadership of Professor John Okoth, of course with my overall leadership, but he's the one who is guiding on top. And there are other leaders, including Dr. Sum, who are responding to it. In the beginning, we used to operate on our own, but we noticed we were not strong. So we joined the efforts with the governor and the county referral hospital. So the governor saw it fit that most may lead in this endeavor, so they chose Michael John Okoth, lieutenant, to be leading on it. So that response is not only developing strategies within the university, but also for the county. So among the things we did, number one is to train people, and we have trained over 400 community. Now there are other initiatives apart from that. One of them is that we asked both lecturers and students to be innovative.
Okay.
And one of the departments is being chemistry. In chemistry, we have been producing products, for example, sanitizers, hand wash, gels, as well as soaps, disinfectants. This, as you know, they are being advocated by World Health Organization at the front line for control of that disease. And then we also minimize the point of entry into the university. The university is to have about 4 gates.
Yes.
But now we are using 1 for now, so that people only come through that, and when they come through, they can be able to be checked, their temperatures through number 2 way of controlling through the thermoguns.
Yes.
Then if people are having any issues, then we know how to manage them from there. But so far, we have not arrested anybody with an issue. God has protected Kakamega so far.
Yes.
Then if they were to be found, then we record their temperature and manage them. Then we have also erected tents in various points within the university where paramedics are using. They are ready in case there will be any emergency. We also have a hotline. May I mention it?
Yes.
The hotline is 0794 653 and 300. So when you call this, you'll get a quick response from our paramedic team. And we also have a free toll number, customer care center number, which is 057 250 5222 /3. There are many things I can say.
Yes.
For example, one, we continually. One thing I want to tell you is that when you go to developed countries, like for example Europe, America, and even China itself, they are proud in controlling this disease through their high tech and their high money. For example, USA, has got many doctors. They have many ICU capacity, ventilators.
Yes.
They have a wide range of medicines. They are now practicing on how to develop a lot of kinds of vaccines. Those things need a lot of money, which our nation may not be having. So we have a third way in which we can control this disease. It's through people. If we know that this is how it's spread, then we can counter against it. The most powerful thing you can do is to equip the community. So the community are knowledgeable.
Kweli.
And we are using what we call the World Health Organization standards that the government keeps on talking about. Maybe we'll talk about this later, but these things to do with the social distancing, putting on the face masks, hand washing, and all those. So what we have done is to develop teams which teach people on this. For example, in the recent times, we used our unions to go out and meet on the prison. They visited the main Kakamega prisons. We supplied there some, apart from teaching the people on how to control this, we also provided them with the materials to do the soaps and whatsoever. Then we went to Shikusa and did the same. And finally, our very own student community. They went to the streets and taught the wale vijana wa mtaa. Wakawafunza jinsi ya kujikinga kutokana na haya maradhi, kuwafunza juu ya social distancing, ya put on masking na kadhalika. Yes. Ndio, kuna sera ambazo zimewekwa na ile ushirika wa dunia ambayo inaitwa World Health Organization, ambayo tumezifuatilia, tumezifundisha kwa wale wafanyikazi na wanafunzi, kama kwa mfano njia za kusafisha mikono ama kunawa kwa sekunde 20 ukitumia maji ambayo yanakimbia. Tena mfano wa pili ni ule kupeana nafasi ama social distancing. Sisi tunahimiza at least not 1 meter, more than that, about 2 meters. And na mwisho kuvalia barakoa. Ningependa kuwahimiza ya kwamba ingawaje tumefunza vijana wengi jinsi ya kuvaa barakoa, lakini wanaweka ili kuprotect the nose. Tunawaambia kwamba barakoa inatakiwa ifunike pua pamoja na mdomo. Ndio inaweza, na ukivaa barakoa si yeye inakulinda wewe, inalinda ule mwenzako. So tunafunza wanafunzi pia na jumuiya. La pili, tumetengeneza mahali pa kunawa. Ukiingia katika chuo chetu utakuta kuna nafasi mahali pengi, mahali unaweza kunawa mikono yako kutumia sabuni, na pia kuweka ile sanitizers. Ya tatu, tumenunua barakoa kwa wingi. Barakoa hii ni ya wafanyikazi na hata jamii wanapotutembelea tunawapea zingine. Then kuna hiyo sanitizers wanapotembea, wafanyikazi wanapofanya kokote, hata kwenye ujenzi, kwenye kukata nyazi, kuna sanitizers. Na ya nne, tumechukua ile amri ya serikali ya kwamba kwa uwezo wetu tungependa kuhimiza wafanyikazi wengi kufanya kazi wakiwa nyumbani. Nitapeana mfano mmoja ambapo tume succeed ama tumefaulu katika kupeana masomo kupitia mpango nao ita Open Distance and Electronic Learning. Tumefundisha wanafunzi wetu waliko kule nyumbani. Na wale walikuwa kuwafundisha walikuwa walimu, na hawakuwa wakiwafundisha wakiwa hapa, waliwafundisha wakiwa nyumbani kwao. Tukipitia njia hizo za mitandao. Kwa vile wanafunzi wetu wamejifunza wengi, kuna about a few wale hawajapatikana, lakini tumeweka mpangilio ya kuwafikia. Watakaporudi ama kwa njia nyingine tunafanya mpango ili wafanye mtihani. Kwa hivyo ni hayo tumeyafuata na mengine. Tunaongea katika mitandao. Tunaweza kutumia mtandao kama ule unaojulikana kama Zoom, ule wa mingine kama Skype, Zoom, alafu Google Meet na mingineyo, hata ile ya Microsoft. Mwanzoni ilikuwa ni ngumu, lakini kwa sasa wameizoea na wanaipendelea kabisa. Ningependa kusema kwamba kuna mitihani fulani ambayo imefanyika. Kwa mfano wale wanafunzi wa masters na wa PhD. Tumepea ile mitihani ya oral, hiyo wameshaifanya. Tena ile ya kufanya continuous assessment test wanafanya. Defenders wamezifanya. Lakini wale wa first degree ama degree ya kwanza na diploma hatujawapea ule mtihani.
Bado
Tunangojea yale maagizo ya Commission for University Education ili tuwapea mkutano wa pamoja hapa. Lakini pia tuna research na labda kama ili janga halitatoka tutulazimu ya kwamba wanafunzi wakae mbali, basi tutawapea mtihani katika mtandao. Kuna njia za kufanya hivyo. This emergency response team came out with what we naturally have. It's like God knew that one time we'd be going through this.
Yes.
And therefore we have different departments with different solutions. For example, if I can name chemistry, chemistry is well stationed and well endowed with production of gels, sanitizers, jik, and other products. Then we have the School of Medicine, which can respond to emergencies, monitoring and treatment, the most health facilities. We also have the School of Nursing, Midwifery and Paramedic, and finally the School of Public Health, and the School of Computing and Informatics, and the whole of management. Now, using that strength, that's where our strength came from, we developed the emergency response team. Now, as I had mentioned earlier, the major person who led us is the retired Colonel Professor John Okoth. The one who is coordinating the emergency response team. We took him because of his experience, not only as a professor, but he was in the armed forces, so he can have very good organizational skills and even leadership skills. And under him, we build a team of people who are in those schools that I mentioned. One of the main persons is Dr. Sung, whom you saw the other day producing an innovation on how to do contact tracing.
Yes.
I don't know whether you saw it.
I saw it. Niliweza kuipata.
So he did it. And one of the immediate things to do was to not only identify places, but also training health staff. Health training was a major thing.
Yes.
And as I said earlier, we have trained over 450 health workers. And we also have 50 master trainers. And also the staff of various institutions like KCB. They ask for trainings. And we also have trained staff in county health workers across the county, all the way to all different places. We have different sub-counties here, and we trained staff in those. So that team is busy doing that and doing other activities as well, with the help of county and the general hospital. Siwezi kusema hizo pesa zinakuja kwetu directly. Hatuna huo mpango. Kwa sababu we are enough. We are supposed to be producers and not dependent.
Yes.
So we give, not depending.
Sio kupewa.
Sisi tunapeana. Lakini tuko pamoja. One, tumetoa hata kununua bidhaa kadhaa za kusaidia county. Na mchango ambao tunapeana kwanza ni wale walimu wa kwenda nje kufunza. Tena tunapeana material. Ya pili, county tunashirikiana nao kwa sababu hao ndio wanao kusanya wale ambao tutawafunza kutokana na sub counties
na kuwaleta mahali moja.
Tena wanawapea lishe na kuwapea vyombo vya kujifunza. So kwa hivyo tunafanya kitu kama timu moja. If you listen carefully, every time they announce the minister about the results, like for example, if he says Kenya today had 40 people who are testing positive,
yes,
he will tell you the samples which were collected were 1,000. But when he goes to the samples of 3,000, you will hear him mentioning 150.
Yeah,
there's an indicator there that if we test more people, we'll get more. And it also expands that if we tested more people in different counties, tukifanya hiyo test katika counties zingine, tutakuwa na nambari kubwa. inaonyesha ya kwamba labda huu ugonjwa huko tunaishi na wao na huo, lakini kwa sababu hatufanyi utafiti wowote, no testing, hatujui
nani yuko nao.
Now tumehimizwa ya kwamba kila county ifanye mbinu zote inayoweza ili kuwa na testing center. So far we don't have it in the county.
Yes.
And we want to ask we the university together with the county government that we now roll to that place, that we do have a testing center so that we can test within Kakamega here and know what amount of population that there is.
True.
I know the government itself is going to do target testing, but I want this to be a continuous thing, a live thing, so we can do it. When I arrived here first, upon formation of this emergency response team, there was desires by other stakeholders, including the county referral hospital and the governor, His Excellency Paranya, Wycliffe Paranya. We had a meeting, and in that meeting we deliberated on many things, and we noticed that we needed a quarantine center.
Yes.
Immediately. We discussed various other alternatives, but that's a long story to go to. But at the end of the day, we identified MMUST'S here.
Yes.
And we have a hall, hall 4, which has been identified as a quarantine center. The reasons behind it, why we chose hall 4, is that it has the necessary facilities. When you talk of the rooms and the beds and all that, which are well, we can have a patient having their own room independently without any interference. So there will be no issue of cross-contamination, as they may call it in science. So we have facilities like available running water, electricity, and ample security. This is not within the main campus, but behind the campus. So it's properly independent on its own. Then most, as I had mentioned, it has departments and staff who I would call medical personnel who are not new in this. They have been trained in emergencies, and they only needed a small twitch and they turn into COVID-19 protection emergency staff. Then apart from this, we are a government institution. We follow the laid down protocols by World Health Organization and those that are being developed by our ministry and other stakeholders. We as a university decided just to put, like I said, we don't want to be dependent. Although it's okay to be supported in a big way, but when you come to the local government, especially the county, we want to be producers because we know the limited funds. So we decided that I would put aside some money. There was some money which were meant for the Vice Chancellor to be utilizing. All of it we declared it will go toward the research. So that has supported a number of research projects. There are quite a number of them. The tune of even over 5 million Kenya shillings be given to researchers so they can research. Then number 2, through government opportunities. For example, through what we call National Research Fund. Not only the government one-off, but even international opportunities. We have encouraged our members of staff to write proposals and gain funding. And already they have collaborated. They have collaborated with not only institutions out of Kenya, but all over East African community, as well as among our universities. For example, in the Western here, I just want to tell you, if you talk of Kibabi, Masinde Muliro, Maseno, University of Eldoret, they have combined efforts. Even the Kaimosi Friends University College, many staff are working to have research in this area. Then finally, we have one major research that we are proud of, that is people are talking about, this use of Artemisia annua. In the past, we were doing it for the sake of malaria. But as you have heard from Madagascar, is one of the ones being done. So we are reviving it. We are behind it. We offer a range of things that impact on humanity, especially in terms of intellectualism, changing social behavior of people. For example, right now, we are going to go into a new order of life. Mambo ya greet each other in the hand won't be there. The university is teaching us for now.
Yeah.
There's no change in cultural and economic ways of doing things. We want people to imagine wealth. There's nothing wrong in imagine. If your objective is wealth, you will at one time reach there. And so we do a lot of teaching, research, consulting, and extension services to the community with changing them, changing the mindset towards the goodness. Then we have rolled out directly, as I said earlier, activities in the home together with the county government that will go towards the community directly controlling COVID-19. For example, I just say the issue of we may not be depending on those very high medical facilities like the Americans do, but through the power of community training, we have this university is training the community, and I can assure you this disease won't get root here because of that. Then through this radio station, the MUST FM radio station, we continue to engage the community, maybe on a daily basis, on how to deal with this issue. We have listeners as far as Shinyalu, Bunyala, Malava, Kayega. 10 kilometers in the air is a wide area. On the road, it could go up to 20 kilometers.
Yeah.
So we believe when we reach these people, they'll be well educated in how to deal with the COVID-19. And then finally, we have empowered our own very staff and the student community. Let's not forget the student community. Already I've said the students came out and they went to visit the vijana wa mtaani. Vijana, I don't like this time of kurandaranda. Hawarandarandi wanaoishi mjini hapa. Wengine hawana nyumba zao, lakini wanaishi hapa. Vijana wetu, wale wanafunzi wetu, wana urafiki na wao. Walienda wakawafunza jinsi ya kujizuia kwa haya magonjwa. Na umesikia union zetu zinania pia kutembelea makao ya vijana. Wanawafunza. So kuna miradi mingi ambayo inaweza kusaidia jamii. My students and our students, I want to thank them for what they have done so far. First of all, they have put our image in a very high standard. One, I want to thank them for when they came around and they participated in what we are doing, especially through their leaders. We still are continuing to do that. I want to urge them that we may soon, I can sense through my bonds that we may be soon be calling them to come on and do their examinations, and if possible, learn in the new normal. Already the university has put in place ways in which we can receive them. They will ensure that if there will be need of masks, they will be provided. Information sharing, their rooms, we ensure that they are kept healthy, they are disinfected if there's need. We'll provide them a rough room so that there's social distancing. Then the emergency response team will still be there to help them. Then when we are put in place, you heard me talking about the hand washing facilities, screening facilities, and all those. Those are there. They are mainly to touch on students. And then before I leave the issue of students, I'm one person who loves students a great deal. Remember, I've been a deputy vice chancellor in charge of students. If you call them, they are part of me. They are the grid. I listen to them as my number one stakeholders. I want to tell them that we are not going to be where we are now. We are going further so that we make their life as much comfortable as possible here. We'll be mindful where they sleep, be mindful times what they eat. We'll be mindful of the quality of education they do. We'll be mindful of what they do after this. Do they get the right career and where they go? The alumni, how do we support one another? And the sky is not the limit. We want to move ahead with the students. Well, I'm a man who fears God. I don't want to prophesy things which are not right. That we are going to have a disease for life. No, this disease will go away. It may only be with us for a few months. But I'm seeing in the future, maybe in the next coming 6 months, we'll have known and kicked this disease away. If China have kicked it away, why not we? If Italy has done the same, Spain, why are we possessing this? I'm refusing that. So all that I want to say is attuned, that we may stay with it for some time. But that time we are going to be with it, we are put in place programs in which we can succeed in dealing with it. For example, I ask us, if you are a student, if you are staff, anybody, please wear your mask. And when you wear the mask, wear it properly. Wear it properly to protect the other person. Then number two, let's listen to what the government is teaching us. Let's listen to what the university is teaching us, and the World Health Organization of the issue, the simple ways they have taught us, including hand washing, sanitizing, screening. In the end, we'll defeat this. And finally, I want to trust that soon and very soon, through our research, we are not only going to discover a medicine, we are also going to discover ways in which we can protect ourselves. For example, just through these normal protocols, how can we protect ourselves?
Yes.
Perhaps is there a way we can do? Then finally, who knows? We also may defeat this thing through vaccines.
Okay.
So I'm not possessing to say that we are going to stay with this for life.
You're optimistic.
I'm optimistic.
Yes.
Thank you.